Good evening. Welcome to the 243rd day of the Swasthya 365 Days project. Today's topic is pancreatic cancer. Pancreas is a fish-shaped organ located in the upper abdomen between the stomach and intestine. Roughly 6 inches long and 2 inches wide, the pancreas helps the body digest and use energy obtained from food. There are two main types of cells in the pancreas which form exocrine and endocrine components. The exocrine glands in the pancreas produce important enzymes that break down food so that the body can absorb nutrients. The endocrine glands have a pancreas of a different job. They make hormones including the insulin and which is critical for balancing amount of sugar in the blood and alter in people with diabetes. Endocrine cells grow in clusters called as islets. In this called as islets of Langerhans. Classification. Tumors appear in both exocrine and endocrine cells, so their treatment different varies. The exocrine tumors. Majority of cells in the pancreas are exocrine. Over up to 90% of the pancreatic tumors are referred to as ductal adenocarcinomas, made up of abnormal cells that rise in lining of the pancreatic duct. Most of them are found near the head of the pancreas, close to the duodenum and bile ducts. They may spread nearby organs, such as bile duct, intestine or stomach, and to adjacent blood vessels. Abnormal cells can also spread to nearby lymph nodes and bloodstream and can deposit in the liver and other organs. Since a tumor in the head of pancreas often block the bile ducts, many patients have the signs of jaundice, yellowishness of the skin and eyes. This may do reduction of the tumor has spread. Another less common type of cancer is ampullary cancer, originating from the bile duct and pancreatic duct meet drain together in the small intestine. These tumors may also lead to jaundice and usually are less aggressive than the pancreatic cancer. Though they are not technically considered as pancreatic cancers, many aspect treatment of ampullary cancer is not similar to that of pancreatic cancers. Endocrine tumors. Tumors of endocrine gland are often fewer than 5% of the pancreatic cancers. These are known as islet tumors or neuroendocrine tumors. Pancreatic neuroendocrine tumors of penis are treated differently than pancreatic adenocarcinomas. They are sensitive to drugs which block blood vessels formation and also different classes of chemotherapy, particularly the alkylating agent. They usually have a better prognosis than adenocarcinomas. It is important to have a pathological review to find which type of cancers they. Symptoms. Initial symptoms includes often mimic those diseases such as viral hepatitis and gallstones, or the patient report none at all. As a result of which, the orphan is diagnosed with once reached with advanced stages. Symptoms may include pain in the upper abdomen, often pain in the back, directly behind the upper abdomen, unexplained weight loss, jaundice, itchy skin, nausea, loss of appetite, diarrhea, fatigue, floating of all smelly stools, depression, ascites, and new or sudden worsening diabetes. Risk factors. However, pancreatic cancer is the fourth leading cancer of death in US. Number of cancer cases in United States and Europe is growing relative to rate of the common cancers for reasons that are not known. Researchers suspect that rise in rates of pancreatic cancer may link to obesity and environmental toxins and lack of screening tests that may detect early tumors. Because people with pancreatic cancer have often generalized symptoms, the disease is usually discovered once it's advanced and difficult to cure. Most people are diagnosed later in their life and between the ages group of 60 to 80. Risk factors may include smoking. About 20% of pancreatic cancers, though it is related to cigarette smoking, people who smoke cigarettes almost have twice to develop their pancreatic cancer as people who don't smoke cigarettes. Additionally, the cancerous tumors that is in turn a result of cigarettes can have an accelerated growth up to 10 years earlier than the other tumors. Diabetes. Pancreatic cancer is twice likely to occur in people with diabetes. However, relationship between the pancreatic cancer and diabetes is not known. Patients often develop diabetes before pancreatic cancer is detected, and the glucose intolerance may be actually caused due to changes in the pancreas resulting in the cancer. Pancreatitis. It is an acute or chronic inflammation of the pancreas. Chronic pancreatitis can occur in the age group of between 35 to 45. It can be used to hereditary genetic factors, malformation of pancreatic ducts, trauma to the pancreas, or heavy alcohol use. Some people have inherited genetic mutations can occur this pancreatitis. Family history of pancreatic cancer. The risk of developing a pancreatic cancer increases by 2 or 3 times if the person's mother or father or sibling or child had a pancreatic cancer. The risk multiplies when a greater of family members is affected. Several inherited gene mutations have been identified to increase the risk of pancreatic cancer, including the genes responsible for the breast and ovarian cancer and melanoma. Diet. A diet high in meat and fat is linked to pancreatic cancer. Height and weight. The body mass index is a statistical measure calculated based on the person's height and weight. A person with BMI score about 25 is considered as overweight, and this can increase the risk of developing a pancreatic cancer. People who are taller and average also increase the risk of developing a pancreatic cancer because of the reason is not understood yet. Occupation and environmental exposure to carcinogens, such as pesticide dyes or gasoline-related chemicals. Certain types of pancreatic cysts. Many people are found to have cysts inside their pancreas, and sometimes a cyst can progress to a cancer. This depends upon many factors such as type of cyst, location of cyst, and the way it changes or grows over time. Thank you.